I believe, reduce suffering. It will allow people to actually live longer because they will have the peace of mind that they are not going to have a horrible death.
Continuing with a panel discussion on this issue, and Josh Patterson is with the BC Civil Liberties, the people who brought this suit. He's in Ottawa. Josh, I want you to address the one concern that I have and that others have, and that is that the court seemed to open up the possibility here of not only assisted suicide for people who are suffering terribly in the last days of their life, which is the admittedly compelling argument that people have in favor of assisted suicide, but people who are depressed. That seems to be going too far.
Well, I don't know if it will cover people who are simply depressed. What the court has said is that people need to be taken with a serious and incurable illness, and that they need to be suffering intolerably.
But it does not have to be a physical, Josh. It does not have to be a physical illness.
Right, I didn't say that, but what I said is that it does need to be serious and incurable. It does not need to be at the end of life, and you're quite right in pointing that out. So someone who is suffering, although they may not be in a terminal condition, could potentially have access to physician-assisted dying. I think what is going to be critical, however, is that it does need to be someone who's mentally competent. So people who, for example, have a mental illness that makes it so that they're unable to make a decision on their own, according to this decision, should not be able to have access to this medical service.
Well, Hugh, I know several people. One's a producer here. She's told her story on television, so I'm not divulging any private information. Another is an actress who has a fabulous show in Toronto. Her name is Shelley Marshall. Both of them tried to commit suicide, young women, and I asked them if you had a doctor who could have done this for you properly, would you have done so? Because the reason they didn't commit suicide is they weren't good at it. That's what I'm worried about. How do you react?
I think you're absolutely right. The reality is that if assisted suicide is a good thing, and respect for people's dignity in this way is a good thing, then why would you deprive that person without capacity, who nevertheless has dementia, is in a nursing home, maybe near the end of life, doesn't recognize who she is, where she is, what's going on? Why would you deprive her this good and this benefit? Why would you restrict it to only people who can consent and have capacity? Why limit the good? And the reality is, as a practical, logical matter, there's no justification for limiting it other than public safety, but you've already opened that door, so why not go all the way?
Well, Michael, in fact, both of those individuals I just mentioned were quite capable of saying, I want to die.
Exactly, and the Canadian Mental Health Association has told us that 20% of us in Canada are going to have experience with mental health issues at some point in their life. You know, I think one of the biggest concerns here is that the criteria for having a terminal illness, as we've got in Washington and Oregon, which are turned to as jurisdictions that show, well, maybe it won't be all that bad, they've got that criteria. The court's taken all those criteria off. So our concern absolutely is this sets the threshold far too low for who's going to have access to this, and we certainly are hopeful that Parliament is going to act to very much narrow and mitigate the risk of this.
Anthony, would you give credibility to this argument we've just made?
Well, yes and no. I don't think they are reasons to say this ruling is completely wrong. I think they're caveats to keep in mind, because when you look at the criminal code and so forth and similar documents, they don't just say, all right, you can go around and kill people now. You have a number of subclauses which outline the various criteria by which something like this would be allowed, in which cases would be legal, and which would be in the sphere of criminality. So I certainly think we should be listening to all stakeholders, because various disability advocates are very concerned about what this means for them. So you need to put in the fail-safes to make sure that these people's concerns are taken care of. But their concerns, I don't think, trump the concerns of a Sue Rodriguez individual who's in a completely different situation.
All right, but Josh, as you went forward with this, I mean, you have countries like Belgium, for instance, that certainly didn't go into this thinking that they would end up putting children to death. So did you ever worry along the line that you might have opened a Pandora's box?
Not in that respect. We've always said that this is about competent adults, and indeed that's what the court said today. We're not talking about children here. And I think that, you know...
Well, they weren't talking about children either when they started.
Well, you know what? We're a mature society, and we're capable of actually coming up with a way of doing this that ensures people's safety. I mean, the whole point of bringing this case was to protect people who are vulnerable. People came to us who said, look, my freedom is being restricted. I don't want to die in the way that the law prescribes that I have to die. I want an alternative. I don't want the government telling me how I ought to die. And we brought the case forward on that basis. It's going to be now for Canadian society, for Parliament, for the legislatures, for the medical profession to figure out how we move this forward. To just say that some people should not have the freedom to choose a more peaceful death because we're worried about some terrible outcome that could happen, I think doesn't make very much sense, and it's clear that the Supreme Court of Canada agreed with us on that.
Well, our concern is that the Supreme Court of Canada didn't actually take adequate account of the evidence before it. For instance, from Belgium, that evidence wasn't adequately weighed in the judgment, and so our view is that the balancing isn't there yet. And I guess furthermore, I mean, the real concern here, if you look at Gloria Taylor's and Kate Carter's materials before the court, they talked about this being an indignity, being dependent on others as being an indignity. And I think the core issue here is that these are not private choices. These are, well, they are private choices, but they have public consequences.
Right.
And the public consequence is setting a standard for what indignity looks like that embraces a whole group of Canadians who are going to be looked at, because they're dependent for toileting and very intimate personal care, as a life that others are choosing as a reason to die and to get state-funded health insurance to do it. And that's, I think, the consequence of these so-called private decisions. The public consequence is what we're profoundly concerned about.
Hugh, the idea that people say, well, I want the right to die with dignity. I don't think dying has indignity attached to it.
Well, it depends on the circumstances, but more significant in my view is the right.
Indignant, you know, it may be uncomfortable, but it's not as if there's something untoward about it. Like your condition is what it is. It doesn't make you less a person.
I agree with that. What I would say, though, is that people should have the right to live with dignity. And living with dignity for people with disabilities in particular includes things like inclusion in education, inclusion in employment, inclusion in transportation, access to quality health care, palliative care, support at the end of the life. And why is the Supreme Court of Canada not taking up those challenges as the true equality test that will ensure people with disabilities can lead meaningful, dignified lives? The court rejects those kinds of claims, which are positive rights claims to things, rejects those, but it's willing to take on this right and effectively impose upon a subcategory of people in Canada the notion that their lives are better off dead than disabled.
I'm sorry, I have to cut in here from Ottawa. That's just not true. That isn't what the court said. The court hasn't dismissed all of these other questions of making sure that services are improved and that equality is there for disabled people. Of course, we support all of those things too, Hugh.
But the court has historically taken a view of Section 7 of the Charter used here to strike down the law to say that it does not require government to take positive actions to improve income situations for people with disabilities, support services, and other measures. And that's the reality of experience for people on the ground.
To be fair, that wasn't the question. The question here was...
It is a question of other cases, though.
The question here was, should the criminal law, all of those things being given, should the criminal law tell someone, dictate to someone who's living in this kind of situation how they should view their own life?
Criminal law never did that.
What their perception of the dignity of their own life is. That is the issue here. And for people who are in this position, who've been saying, we want to have this choice, they should be allowed to have this choice. That is what the court has said. And they've said nothing at all to the effect that these lives aren't valuable. What they've said is that because we value life and because we value individual choice, the ability of people to make choices for themselves, that this restriction in the criminal code is inappropriate. This is all about making sure that people have their dignity and have their choice, and that the government isn't telling them how they should live their life when they are suffering.
Jerry, I see no reason why everyone's demands can't be meted and satisfied. I mean, when you have an able-bodied adult who is at that point in life where the Supreme Court says, yes, you should be able to end your life, you should do that. And then to Hugh's point, creating a society where people of all different abilities can economically prosper and so forth, I think those are things we should all be able to accept and introduce in our various ways of policy. It's not mutually exclusive here. And that's the main argument I have looking at this, that I don't think this is an issue of competing rights.
Except it doesn't work. In Belgium, 32% of people euthanized under the same law that's in place in Quebec were killed without the request, were killed without consent. And in 47% of those cases, the doctors, despite a legal requirement to report it to the Belgian authority, never did so. And not one Belgian doctor has been prosecuted. It doesn't work, it hasn't worked, and it's not going to work any better here.
That is just a sign of crafting best practices. Michael's
No,
talking
they
about
don't work.
Oregon policies and so forth.
They don't work.
But you're saying there's only 8 jurisdictions where this is really in play. Well, then we can say 8 folks have failed, or there have been certain situations where it hasn't worked.
That's enough
Well,
evidence
then the
for me.
9th one or the 10th one, you learn from their mistakes and you improve it. These
Well,
are
you're right.
clearly not situations. I mean, you're saying the law was broken and it was not upheld there, and there are also problems with the law. Then we work towards not having those problems when we move forward with
You're
this.
right about
We
that.
just- we just learn from
The
it.
question's going to be what number of people dying is satisfactory in terms of a tolerable risk. How many people have to die in terms of a body count before we recognize that there's a problem?
But there's already body count right now, and it's illegal. We know these things are already happening to some degree in Canada. So I don't see how that invalidates getting a new law in place.
Well, Josh, what I worry about that you've put in place, I had the opportunity earlier this morning on my talk radio show to take response from people, and I was actually very disappointed to hear the number of people who called me, well-meaning, nice people, who talked about grandma, and they can't really communicate with her anymore. He's tying it into this. It would be nice to just move grandma into another life. It wasn't grandma who was suffering. Apparently it was the family who didn't like having her lay in a bed. And I had another caller who talked about these poor, unfortunate people who are in senior citizens' homes and nobody's visiting them and they're just sitting there in wheelchairs. So might as well off them as well. Josh, whether you like it or not, that's what you've put in place.
That case is being argued next week in British Columbia.
All right.
That is not, in fact, what's been put in place. You may have callers to your show who are saying, really inappropriate things about what they want to do to grandma. That isn't what this case is about. This is about individuals themselves having the right to choose. It does not allow others to make that choice for them. Right now, it is the federal government that makes that choice for everyone. That is now being changed so that individuals will have the right to choose. Not the nephew, not the caretaker, and not the worker at the retirement home. It is for individuals to choose.
Except drawing the boundary between the so-called competent to make this choice and incompetent it's not like there's a bright line.
Yeah.
And that's something we do in all kinds of medical treatment, and we're going to have to be very careful about that. And if people are doing this wrong, they will be committing a crime.
All right,
doctors
Josh,
are doing this,
let her respond to what you said.
We know from the research, we know from the evidence in the jurisdictions where it has been legally provided for, that people who have experiencing end-of-life psychological issues, suicidal ideation, all of these things come with difficulties, disabilities, irremediable conditions of disease and illness. And the court has said this condition includes illnesses, disability, and disease. It's defined a very large group, and I don't know how we're going to have to do a better job clearly than Belgium, but it's not that easy a job. It slips into another group.
Now, we're going to break and then we'll come back with the panel and talk about where we think this is going to go because the court has not changed law as it is in Canada today. They've given a 12-month hiatus here for the government to make a decision, as they did with the prostitution decision a year ago. So that's next on Straight Talk. Back with the panel to discuss the Supreme Court decision. Let's talk here for about a minute each as we go around the horn on what you think will happen over the next 12 months the Supreme Court gave to the government, starting with Josh in Ottawa. Josh?
Well, thanks. What the Supreme Court said is that Parliament and the legislatures may legislate. They haven't imposed an obligation on them to do so. Obviously, it's probably the case that Parliament or provincial legislatures are going to feel like they need to do something. And of course, the BC Civil Liberties Association has said all along that we think there need to be robust safeguards in place. So we expect that the conversation is going to go towards what we've been talking about here this afternoon, which is is how do we ensure that this is rolled out in a way that provides access for people to this kind of health care, physician-assisted dying, while protecting vulnerable people and respecting the Supreme Court's ruling. We think that's an important conversation to have, and we think today is the start of that conversation. And it's been great to be able to talk about it here today with the rest of you in Toronto.
Josh, really appreciate it. Thank you very much. Hugh?
I think what you're going to start to see is provinces begin to redefine healthcare as including the intentional killing of patients by doctors, which is what's happened in Quebec. And I think you're going to start to see that come more and more across the country. And I think Parliament's going to be very limited in what it can do in terms of regulating this issue because of our healthcare jurisdiction being a core provincial jurisdiction. And the Supreme Court of Canada acknowledges this to some extent. And that's going to create major problems in terms of having any kind of universal safeguards or regulation across the country that's meaningful and that's safe.
It's going to be challenging to have a national conversation given that jurisdictional issue. I think we need to place this not just in terms of a right to an intervention that causes your death, but Canadians, I think, have been pushed up against a wall because of the lack of palliative care and other supports. That the issue here is lacking access to those positive interventions that mean people are left in a situation where they don't have the support they need, they don't have the palliative care, life is looking absolutely miserable. And I think we have to, in this conversation, we're going to have to focus as much on those positive interventions and positive rights as we do on finding ways to really, really tightly narrow access to this. And that's going to be challenging to do in this context. We think it's wise to take some more time to do this rather than, as Stephen Fletcher has encouraged, to get this done in this session. Let's take the 12 months we've got and do it as best we can.
Okay, thanks. Now, whatever reaction you want to have is fine, but also, Anthony, because of the kinds of things you cover, do you think that this is something that Conservatives would want to make an election issue, or do they want to try to get it done?
And first, I'll say I think Michael's right about the palliative care issue there, and with an aging population, you really want a strong health care program, or else you are just pushing people towards making this choice. On the federal scene, I think it would be political poison for this to be an election issue, whether it's coming up in October federally or in any province, just because these sort of social policy issues, they really stand astride of general left-right divides. It's about faith, it's about the people you know in your life, who you interact with, personal experience and so forth, and it's really across the board. So I can't see any politician really doing a strong fight for this,
right.
For or against it, making it a major platform issue.
Well, they've talked about maybe hooking onto a private member's bill that was already kind of going, so we'll see if they do that. Thanks to all of you.
Thank you.
Thanks so
Appreciate
much.
it very much. Now, Jake.